Hi, I'm Rabbi Hammer, and this is Simply Mental Health. Please remember at the end of this video to subscribe below, and feel free to send me all of your comments. I will try my best to address them accordingly. Look forward to hearing from you. This past week, I sat together with my daughter, one of our older daughters, and with our youngest son, 17-year-old. And we were speaking about the after effects of the loss of Gila, the tragic loss of our daughter. And one of the words that we were throwing around freely and uncomfortably was the word trauma. One can experience trauma. One can go through trauma after a particular event. And our son, my 17-year-old, he said, what does it mean, or what does it feel like to go through trauma? And I said to him, that's a very legitimate question. It's a question that I want to address today. Now, when we go or try to explain or define what exactly trauma means, it probably would be easier for us, or more manageable as such, to define the term traumatic events. Because most traumas are the result of particular events that transpire in someone's life. There is something that is called acute trauma, which means a specific event, something specific that happened one time off that causes trauma in a person's life. For example, what I just described, unfortunately, a few moments ago, the death of a child or the loss of a loved one. It could also be a sexual assault or a particular assault that happens to a person. Divorce is an example of an acute trauma, or that can cause acute trauma. The loss of a job, unemployment, also is an example of a one-time event that can cause a person to go through trauma. And then there's something called chronic trauma. Those will be events that continuously transpire, that consistently take place in a person's life, and therefore they are always feeding or causing that person to experience trauma. Example of that would be consistent assault, verbal assaults, sexual assaults. A person goes through these consistently by someone who is abusive, and they are going through what we would call chronic traumatic events. The result is that there are various symptoms, be it from an acute trauma that happened once or a chronic trauma that consistently transpires. There are certain symptoms that exhibit that particular trauma or a person experiencing trauma. So, for example, the traumatic symptoms that would be described could be shock, a state of confusion, anger, irritability, an inability for a person to cope under normal circumstances, mood disorders, anxiety, as we would know it, and certainly social withdrawal. And finally, something that we're familiar with, I spoke about it 2 times ago in the last videos, sadness, depression. When a person just cannot cope with everyday occurrences because they are in a state of depression. These are all symptoms that a person might experience as a result of having gone through a traumatic abuse or a traumatic event. Gila certainly had gone through a particular chronic trauma. She was sexually assaulted, and that caused her to go through many of these symptoms which were clearly evident through her behavior or lack of her behavior thereof following that particular traumatic event. So, for example, Gila would certainly have been described as very socially capable. She was a social leader. One would describe her as a social butterfly. But following that particular traumatic event of that assault, she became completely withdrawn. She had a difficult time speaking, conversing with people, and certainly within social stratospheres, social atmosphere, she was not the same person as she was before. I myself, when I read through the list of symptoms that describe someone who has gone through trauma, I said to myself, wow, many of those symptoms describe myself after the loss of a child. I very often become socially withdrawn. I very often am dealing with a lack of sleep. I very often am dealing with mood irritability. And these are symptoms that a person experiences when they go through a traumatic event. Now, not everyone who has experienced trauma is necessarily going to develop what we would call a mental illness. But often, if a person or if those symptoms continue to fester within that person for 6 to 8 weeks and completely disrupts their ability to function under normal daily functions, then yes, one would suspect that certainly a mental illness seems to be brewing. Classically, the mental illness that brews after traumatic events is something that we would call PTSD, post-traumatic stress disorder, whereby, again, as I said, it disrupts that person's ability and consumes them so much so through the trauma that they experience that they cannot go through or move through the daily functions. And obviously, when a person is developing those disorders or that disorder or anxiety, depression, or as I said, PTSD, post-traumatic stress disorder, they must be seen to. Some of the things that a person can receive or that one can do in order to help a person going through these traumatic experiences, these traumatic illnesses, is number one, surround them with people who they care for them and who they trust, who they can converse with, who they can feel comfortable with. Number two, to make sure that they're looking after their physical health. That could be in terms of their eating habits, making sure that they are still receiving the proper nutrition, perhaps also offering them an exercise program that can sometimes bring them to a better state and create a better or more positive feeling about them. And of course, sometimes also taking a break from their daily routines, going away for a few weeks or having a breather, that helps as well. And of course, a CBT, cognitive behavioral therapy, something that we've also discussed in past sessions, but the therapy would have to be consistent. Usually when a person is dealing with PTSD or with a serious traumatic disorder and a mental illness, it's something that will, in all probability, linger with them for the rest of their lives. But having said that, that doesn't mean that it cannot be treated and that they cannot, with treatment and with therapy and with consistent care, that they cannot live a regular life and function during the normal functions of living as well. So it's important for us to bear that in mind. I hope and pray that we are able to be aware of the people about us and that those who are going through trauma, that we could be sensitive to them and hopefully approach them and offer them patterns to proper care. Thank you for listening today. I look forward again, I remind you to subscribe below, and I look forward to hearing from you, your comments, and certainly will try to respond accordingly. We should all have good health and a fantastic day and know only good things.